Thank you. Thank you so much, Ms. Pretty, for taking us through the recommendations. Our next speaker is Professor Lawrence Gostin. He is a university professor at Georgetown University. Professor Gostin directs the O'Neill Institute for National and Global Health Law, and is also the founding chair of the O'Neill Global Health Law. Professor Gostin is also the director of the World Health Organization Collaboration Center on National and Global Health Law. So he is going to address the question, do we need a treaty or convention? And he will draw on the lessons from the framework of the Convention of Tobacco Control and IHR. Over to you, Prof. Gostin. Prof. Gostin, are you there?
You're on mute, Prof. Gostin.
Yes, my apologies. Can you hear me now?
Yes, we can. Thank you.
Okay, I'm sorry. I did mute myself. I wanted to thank you and wish you all a good day, and to say that this is an important day in the United States for the pandemic, because President Biden is going to be proposing a 6-point plan to deal with the Delta variant. And I understand that among his 6-point plans will be hosting a global vaccine summit at the UN General Assembly coming up in just a week or so in New York. So as we all know, on March 30th, 25 heads of states joined by the World Health Organization called for an international treaty on pandemic preparedness and response, a very high level of political action. The World Health Assembly, then in an historic meeting, asked for a special session of the Assembly this November to focus solely on the idea of a pandemic treaty. And it's going to be preceded by two important events, the UN General Assembly that I've just mentioned, and the G20 group of nations in October. And WHO Director General Dr. Tedros has said that these three events, the UNGA, the G20, and the World Health Assembly are going to be three pivotal moments in the history of global health security. So as the speakers have said so eloquently, we've had enormous gaps in global health governance, in prevention and pandemic preparedness and response to SARS-CoV-2. And it tested the current governing framework of the international health regulations to its limits. It exposed gaps, for example, the failure to promptly notify the World Health Organization of a widely circulating novel coronavirus in Wuhan, and WHO's inability to independently verify official state reports. Weak WHO compliance measures with the IHR and with its own recommendations under the IHR, so that there hasn't been full accountability. WHO's lack of power to monitor, investigate, and remediate harmful actions. And I also agree that the WHO is badly and inadequately funded, and it needs to have more independent sources of funding. And insufficient transparency and international exchange of scientific data, including pathogen specimens, but more importantly, genomic sequencing data and other research on global public goods like diagnostics, therapeutics, and vaccines, and lack of global cooperation and equity, particularly in the equitable allocation of vaccines and other medical resources. Currently, probably the biggest danger facing the world are the cavernous gaps in vaccination coverage between high-income countries and low and middle-income countries. And even the most basic investigations, such as ascertaining SARS-CoV-2 origins, have been unsuccessful thus far. And the most important thing is that 2/3 of countries do not appear to have core health system capacities to detect and alert the global community about novel outbreaks, including communication, surveillance, and response capabilities. And even with the WHO's joint external evaluation systems and systems of supporting health systems do not exist. So what are the options that are available to the international community? Well, while WHO itself has been the focus of global attention on a pandemic treaty, the United Nations itself does have extensive power in negotiating large-scale treaties. It's done so for the Framework Convention on Climate Change and the Convention on the Rights of Persons with Disabilities. And the Global Preparedness Monitoring Board, convened by WHO and the World Bank, did recommend a pandemic treaty under UN auspices. The United Nations does have to be part of the solution. It has comparative advantages, including a multi-sectorial approach. Climate, food, and animal health are intimately connected to human health. So we need to have a one health system, enhance compliance capabilities, and the ability to raise pandemic preparedness to high levels of government. The UN also has wide experience in financing, supply chain management, and humanitarian response, which are all essential for pandemic preparedness. The WHA, however, envisaged a WHO instrument, and WHO is the leading specialized UN agency for health, so that makes sense. WHO has broad constitutional authority to adopt binding agreements. Under Article 21, it can adopt regulations. It adopted the international health regulations as an example of an Article 21 regulatory authority. And the IHR were most recently revised in the light of SARS-CoV-1 in 2005. But the IHR does have limited scope and weak compliance. And the question is whether IHR reform is enough to get us where we need to be. It may not be. So WHO also has the power under Article 19 to adopt a convention or international agreement. And it's done that only once with the Framework Convention on Tobacco Control. The Framework Convention has clear flaws, as does the international health regulations, but it's been a transformative vehicle for stemming tobacco use in the world and for controlling both the demand and supply side of tobacco. The Framework Convention on Tobacco Control is the only framework convention the WHO has ever adopted. Framework conventions may be a very good model for a pandemic treaty because they give member states enormous flexibility. They can agree on broad principles of global health security, and that they can strengthen those principles with detailed protocols over time, which is why it's called in international law circles a framework convention protocol approach. The Framework Convention on Tobacco Control only has one major protocol, which is on the illicit sale of drugs. But the Framework Convention on Climate Control has many protocols and additional agreements, including the Paris Agreement. There are many countries around the world, including my own, the United States, who has expressed interest in heightened transparency and accountability, but through what we call soft international instruments, as opposed to binding treaties. There's a group of people who believe that treaties are hard to negotiate and it's hard to get countries to give up their sovereignty, but that you can create more robust norms more informally. And so that's another possibility, although I think a combination of hard treaty and soft law approach might be a more flexible and better way of dealing with this. Article 23 of the WHO's Constitution gives it the power to adopt recommendations, which are non-binding, but they do create important global norms, such as the marketing of infant formula and the international recruitment of health workers. The WHO has also negotiated important other international agreements that can make enormous impact. The most important one, I think, is the Pandemic Influenza Preparedness, or PIP framework, which it negotiated after Indonesia refused to share H5N1 pathogen samples. And it did so based upon the government's view that it would not share equitably in the benefits of vaccines, diagnostics, and therapeutics with the research that was ongoing. And the Nagoya Protocol, another international instrument, actually is in tension with the PIP framework because it says that novel pathogens are the sovereign ownership of the government in which they're detected. And I think that must be wrong, that pathogens and research with pathogens are a global public good. And so full sharing and transparency and cooperation in scientific data are absolutely essential. But so too is full and robust equity and sharing the benefits. And any international instrument needs to deal with both of those issues. So what is the content, a possible content of an international instrument? This could be wide-ranging and it'd be very difficult to negotiate, but in my view, very important to negotiate. The IHR, first, we could try to prevent zoonotic spillovers. As has been pointed out, some 70% of all novel outbreaks have a zoonotic origin or an animal origin. And so we could try that, but the IHR focuses on response to novel outbreaks after they occur. But a new instrument could also focus not just on response, but on prevention of naturally occurring zoonoses. So separating animal and human populations could help prevent such spillovers. And this could be done through land management, reforestation, and effective regulation of wild animal trade and markets. Biosafety and biosecurity are important too. While SARS-CoV-2 almost certainly occurred naturally in nature, a laboratory leak at the Wuhan Institute of Virology is an alternative theory of the virus's origins. So in any case, rigorous ongoing and future regulation and inspection of laboratory safety, as well as gain of function research, could help prevent unintentional release or deliberate release of a novel pathogen. WHO has issued international guidance on biosafety that could be incorporated into a new agreement. Third is monitoring, inspection, and compliance. Responding to weak IHR compliance and accountability, a new international instrument should enhance WHO and/or UN authority and legitimacy in independently verifying state reports and publishing crucial outbreak data without state confirmation. It needs to investigate novel outbreaks independently and institute remedial actions. I've already mentioned research, scientific sharing, and transparency. And I think that scientific cooperation helped get us a COVID vaccine very quickly. And we need ongoing research and ongoing cooperation among the international scientific community with open access information, transparency, and the like. Health systems are at the foundation of all preparedness. All countries need to have the ability to rapidly detect and respond to novel outbreaks with robust health system capacities, including human resources, surveillance, laboratories, risk communication. They need capacities for contact tracing, testing, vaccination. Clinics, community health workers, and hospitals are needed to care for and treat patients during spikes and surge capacity, as well as meeting everyday needs such as childhood vaccinations, maternal care, and non-communicable diseases. And finally, and most importantly, is domestic and international equity. Equity that doesn't separate and divide us based upon race, gender, disability, or socioeconomic status. The WHO and partners Act Accelerator is a wonderful innovation, but it hasn't done the job. It hasn't been supported. And any new international instrument must plan for adequate supplies of medical resources and treating them like global public goods available to all. This could include supply chains, resources and equitable allocation of medical resources, technology transfers, transfer of knowledge, and intellectual property waivers, along with other equity enhancing measures. So all in all, I would just conclude by saying this. Doing the hard work of an international instrument with robust norms and health systems and financing is going to be very a heavy lift. Countries prize their own sovereignty. They tend to be inward looking, particularly high income countries, looking at my country first. But if we're ever going to break this horrible cycle, we need to do it now. I have a new book out with Harvard University Press called Global Health Security, A Blueprint for the Future. And the thesis is that whenever there's a crisis, we lurch from panic to complacency, and then back to panic and complacency. And I hope the COVID-19 pandemic won't repeat this pattern. That if there's ever a time when history demands that we act, demands of our political leaders that they lead, demands of our international organizations that they respond, now is the time. Because out of this horrific ongoing crisis could become an opportunity. And we can't let that opportunity fade. It's up to all of us to lobby our governments and our UN and WHO institutional friends to pass a robust treaty with compliance, monitoring equity, justice, and human rights and accountability at its core. Thank you for organizing this conference, and I'll now turn it over back to you.